no promo. A label, the kid is going solo. The drop, cause I'm balling off that EDD. No Tesla, swerving on the P.
Yep, that's me. You're probably wondering how I ended up in this situation.
SBAR communication dialogue between doctors and nurses.
Assalamu alaikum, doctor.
Walaikum salam wa rahmatullahi wa barakatuh.
Introduce me, Nurse Desai from the internal medicine ward.
Oh yes, is there anything I can help you with?
Today I will convey the condition of Mr. Arif's patient. When this patient was in the ward, his blood pressure was 150/80th mmHg, his pulse was 120 by a minute, and his breathing was 40x minute. There were ronky breathing sounds. Then the latest lab results showed his HB was 9 milligrams DL.
Okay. May I know the medical diagnosis?
Yes, Mr. Arif's condition was admitted to hospital on June 23, 2020. The patient entered the emergency room with ascites and edema in the legs. Said the patient had experienced kidney failure for three years. Doc. Then he had routine dialysis, but on 23rd June patients felt discomfort in their bodies, so they decided to enter the hospital. In the emergency room, the patient was placed in a semi-Fowler's position. Then a catheter was inserted and oxygen was administered at 3L minute. Observation was then carried out. Doc. After 15 minutes in the emergency room, the SaO2 test results showed 88%, and his blood pressure was 130/100ths, with a respiration rate of 28 breaths per minute. Additionally, his pulse was recorded at 110 beats per minute. An hour later, the patient was transferred to the treatment ward, where an examination was conducted by the DCP doctor. The patient received a medical diagnosis of chronic kidney failure. Doc. Treatment measures were implemented, including 3x1 ampule Lasix injections, and if to monitor urine output as an indicator of electrolyte fluid imbalance. Doc.
Okay. Has there been any assessment or analysis from the nurse?
Yes. The nurse's analysis indicates that the patient is experiencing impaired breathing patterns and fluid instability beyond what the body needs. Here, should we suggest replacing the patient's oxygen with NRM? Doc. Additionally, should we increase diuretics?
Okay. Ma'am, my suggestion is to administer oxygen at 8 liters per minute using a non-rebreathing mask, followed by giving 2 ampoules of Lasix. Keep monitoring breathing, blood pressure, and urine output continuously.
Okay. Thank you, doctor. I've noted it down. Just to confirm, we'll provide the patient with a non-rebreathing mask delivering 8 liters per minute of oxygen, administer 2 ampoules of Lasix, and continue monitoring breathing, blood pressure, and urine output. Is that correct, doctor?
Okay, that's right.
Okay, doctor. Thank you for the advice. Assalamu alaikum wa rahmatullahi wa barakatuh.
You're welcome. Walaikum salam wa rahmatullahi wa barakatuh.